Imagine a child diagnosed with severe ADHD, struggling to focus in school, constantly interrupting conversations, and feeling frustrated because they cannot control their impulses. Their parents are at their wits' end, and the teacher suggests medication as a possible solution. Now, imagine another child with severe anxiety, experiencing daily panic attacks, and unable to sleep due to intrusive thoughts. A psychiatrist recommends an SSRI, but the parents are hesitant. Will this change their personality? What about side effects? These dilemmas highlight one of the most debated topics in clinical child psychology: pharmacological interventions. Medication for children with mental health conditions has been a subject of both groundbreaking progress and intense controversy. Over the past few decades, the use of stimulants, antidepressants, antipsychotics, and mood stabilizers in children has increased significantly. According to the CDC, about 6.1 million children in the US have been diagnosed with ADHD, and over 60% of them take medication. Similarly, the use of selective serotonin reuptake inhibitors for childhood depression and anxiety has nearly doubled since the early 2000s. Stimulants like Ritalin and Adderall have been used since the 1960s to manage ADHD symptoms, improving focus, impulse control, and hyperactivity. Research shows that 70 to 80% of children with ADHD experience significant symptom reduction with stimulant medication. However, side effects such as insomnia, appetite loss, and mood swings have raised concerns, leading some parents to explore behavioral interventions before turning to medication. When it comes to anxiety and depression in children, SSRIs like fluoxetine and sertraline have been widely prescribed. The landmark treatment for adolescents with depression study found that a combination of fluoxetine and cognitive behavioral therapy led to the most significant improvements in depressed adolescents. However, the 2004 FDA black box warning on SSRIs regarding increased risk of suicidal thoughts in some children has made many clinicians more cautious in prescribing these medications. Antipsychotics like risperidone and aripiprazole are also used in children, primarily for severe aggression, autism spectrum disorder, and bipolar disorder. While they can be effective in managing emotional dysregulation and reducing severe behavioral issues, they come with notable risks such as weight gain, sedation, and metabolic changes. A 2020 study found that children on long-term antipsychotic medication were at a significantly higher risk for obesity and diabetes, raising ethical concerns about their use, particularly in cases where behavioral therapies could be prioritized instead. And this is where the ethical debate comes in. One of the biggest questions is, are we over-medicating children? In some cases, children as young as 3 or 4 years old are prescribed stimulants or antipsychotics, despite limited research on long-term effects. Critics argue that psychotropic medication should never be the first line of treatment for behavioral and emotional difficulties, and that therapy, lifestyle changes, and family interventions should always be prioritized. Others, however, emphasize that for some children, medication is life-changing, allowing them to function in ways that would otherwise be impossible. Another ethical issue is informed consent. Unlike adults, children cannot fully understand the implications of taking psychiatric medication. The decision falls on parents, clinicians, and sometimes the child themselves, leading to concerns about whether children are truly given a voice in their own treatment. There's also the socioeconomic aspect. Children from low-income families are statistically more likely to be prescribed medication rather than receive comprehensive therapy, often due to lack of access to qualified mental health professionals. This raises the question, is medication being used as a substitute for proper psychological care in underprivileged communities? Despite the controversies, most experts agree on one thing. Medication alone is rarely the best approach. The most effective treatments often involve a combination of pharmacological and therapeutic interventions. The multimodal treatment of ADHD study found that while medication was highly effective in reducing ADHD symptoms, the best long-term outcomes were achieved when combined with behavior therapy and parent training. With ongoing advancements in neuroscience and psychopharmacology, the future of psychiatric medication for children is evolving. Researchers are exploring personalized medicine using genetic testing to predict which medications will work best for individual children. This could help reduce trial and error prescribing and minimize adverse effects. At the heart of this discussion is a delicate balance between benefits and risks. While psychiatric medication can be a powerful tool for improving a child's quality of life, it must be used thoughtfully, ethically, and as part of a comprehensive treatment plan that prioritizes the child's well-being. The goal is not just symptom management, but empowering children to thrive in the long term.